Today we are going to discuss about hepatitis. Hepatitis is chronic inflammation of liver. In this hepatitis, two types of hepatitis are there. One is one is chronic hepatitis, second one is acute hepatitis. Hepatitis refers to an inflammatory condition of the liver. It is commonly caused by viral infection, but there are other possible causes of hepatitis. These include autoimmune hepatitis and hepatitis that occurs as a secondary result of medications, drugs, toxins, and alcohol. Autoimmune hepatitis is a disease that occurs when our body makes antibodies against our liver tissue. Where is the actual position of liver? Liver is located in the right upper area of abdomen. It performs many critical functions that affect metabolism throughout our body, including secretion of bile juice. Bile juice is essential for digestion. Bile juice it that emulsify the fats that is simplify complex fats will be converted into simple fats. And bile juice also converts the acidic medium food into alkaline medium. In alkaline medium only, enzymes are functional. Then filtering the toxins from our body. Excretion, excretion of bilirubin is a product of broken down RBCs, cholesterol, hormones, and drugs. Breakdown of carbohydrates, that is glycogenolysis and glycolysis, and it also helps in glycogenesis, then lipogenesis. Next, it synthesizes ADVK vitamins, and it also synthesizes blood clotting factors like thromboplastin, fibrinogen, etc. And it also breaks down the carbohydrates, fats, proteins. It also secretes blood, co- blood coagulating factor, anticoagulating factor, heparin, which helps in proper circulation of blood in our blood vessels. Activation of enzymes, which are specialized proteins essential to body functions. Storage of glycogen and minerals and vitamins like A, D, E, K. Synthesis of blood proteins such as albumin. Synthesis of clotting factors. And it also works as it stops whatever the toxic materials enter into our body, that effect will be nullified by the liver. And liver is an antiseptic organ. It also maintains homeothermy. If at all any excess heat generated in our body, that will be equally distributed throughout the body. Coming to hepatitis types. What are all the types of hepatitis? Viral infections of the liver, These are classified into hepatitis A, hepatitis B, hepatitis C, hepatitis D, hepatitis E. Hepatitis A is caused by HAV and hepatitis B is caused by hepatitis B virus. Hepatitis C is caused by hepatitis C. In this, hepatitis D is caused by hepatitis D virus. In all the five, hepatitis A is always an acute short-term disease, while hepatitis B, C, D are most likely to become ongoing and chronic. Hepatitis E is usually acute but can be particularly dangerous in pregnant women. Hepatitis A. Hepatitis A is caused by an infection with the hepatitis A virus, that is HAV. This type of hepatitis is most commonly transmitted by consuming food or water contaminated by feces from a person infected with hepatitis A. Hepatitis B. Hepatitis B is transmitted through contact with infectious body fluids such as blood, vaginal secretions, semen containing the hepatitis B virus, that is HBV, or injecting drugs, having sex with an infected partner, or sharing razors with an infected person increase your risk of getting hepatitis B. It is estimated by the CDC trusted source that nearly 1.2 million people in US suffering from hepatitis B and 350 million people worldwide live with this chronic disease, that is hepatitis B. Hepatitis C. Hepatitis C comes from hepatitis C virus. Hepatitis C transmitted through direct contact with infected body fluids, typically through injection, drug use, and sexual contact. HCV or hepatitis C virus among the most common blood-borne viral infections in United States. Hepatitis D, also called as delta hepatitis. Hepatitis D is a serious liver disease caused by hepatitis D virus, that is HDV. Hepatitis D virus is contracted through direct contact with infected blood. Hepatitis B is a rare form of hepatitis that only occurs in conjunction with hepatitis B infection. Hepatitis B virus can't multiply without the presence of hepatitis B. Here, when a person is infected with hepatitis D, then he must be having hepatitis B also. It is this kind of both having one person hepatitis B and hepatitis D infection is very uncommon in US. Hepatitis E. It is waterborne disease caused by hepatitis E virus. Hepatitis E is mainly found in areas with poor sanitation, typically results from ingesting fecal matter that contaminates the water supply. This disease is uncommon in the United States. However, cases of hepatitis E have been reported in the Middle East, Asia, Central America, and Africa, according to CDC trusted source. Causes of non-infectious hepatitis: alcohol and other toxins. Excessive alcohol consumption can cause liver damage and inflammation. This is sometimes referred to as alcoholic hepatitis. The alcohol directly injures the cells of liver. Over time, it can cause permanent damage and lead to liver failure and liver cirrhosis, a thickening and scarring of the liver. Other toxic causes of hepatitis include overuse or overdose of medications and exposure to poisons. Autoimmune system response. In some cases, the immune system mistakes the liver as harmful object and begins to attack it. It causes ongoing inflammation that can range from mild to severe, often hindering liver function. It's 3 times more common in women than in men. Autoimmune hepatitis are more common in women than men. Symptoms. What are the symptoms of hepatitis? Coming to symptoms, if you if any person gets infected with HIV, hepatitis B, hepatitis C, he may not or she may not show any symptoms in the beginning. Symptoms may not occur until damage affects the liver function. Signs and symptoms of acute hepatitis appear quickly. They include fatigue, flu-like symptoms, dark urine, pale stool, abdominal pain, loss of appetite, unexplained weight loss, yellow skin and eyes, which may be signs of jaundice. Chronic hepatitis develops slowly, so these signs and symptoms may be too subtle to notice. How can we diagnose a person is suffering from hepatitis? By history and physical examination. To diagnose hepatitis, first your doctor will take your history to determine any risk factors you may have for infectious or non-infectious hepatitis. Like in recent he he used to drink contaminated water or contaminated food, or else if at all that person is alcoholic. These are all notes asked by the physician. During the physical examination, your doctor may press down gently on your abdomen to see if there is pain or tenderness. Your doctor may also feel to see if your liver is enlarged. If your skin and eyes are yellow, your doctor will note this during the exam. Liver function test. Liver function test use blood sample to determine how efficiently our liver works. Abnormal results of these tests may be the First indication that there is a problem, especially if you don't show any signs on physical exam of liver disease. High liver enzyme levels may indicate that your liver is stressed, damaged, or not functioning properly. In LFT, enzyme levels will be elevated. That means liver malfunction. Other blood tests. If your liver function tests are abnormal, your doctor will likely order the other blood tests to detect the source of the problem. These tests can check for the viruses that cause hepatitis. They can also be used to check for antibodies that are common in conditions like autoimmune hepatitis. If a person's blood test and liver function tests are normal and physical examination is normal, immediately physician will advise to check for antibodies for autoimmune hepatitis. Ultrasound. In ultrasound test, an abdominal ultrasound uses ultrasound waves to create an image of the organs within your abdomen. This test allows your doctor to take close at your liver and nearby organs. It can reveal fluid in your abdomen that is called as ascites. Liver damage or enlargement, liver tumors, abnormalities of your gallbladder. Sometimes the pancreas shows up on ultrasound images as well. This can be useful test in determining the cause of abnormal liver functioning. Liver biopsy. A fine needle is injected into the liver and some fluid is extracted, and that will be examined under microscope. That is called as some of the tissue is taken from and examined. That is biopsy. Liver biopsy. A liver biopsy is an invasive procedure that involves doctor taking a sample of tissue from your liver. It can be done through your skin with a needle and does not require any surgery. Typically, an ultrasound is used to guide your doctor when taking the biopsy sample. This test allows your doctor to determine how infection or inflammation has affected your liver. It can also be used to sample any areas in your liver that appear abnormal. Treatment. Hepatitis A usually does not require treatment because it's a short-term illness. Bed rest may be recommended if symptoms cause great deal of discomfort. If you experience vomiting or diarrhea, follow your doctor's advice for hydration and nutrition. Hepatitis A vaccine is available to prevent this infection. Most children begin vaccination between ages of 12 months to 18 months. It is a series of two vaccines. Vaccination for hepatitis A is also available for adults and can be combined with hepatitis B vaccine. Hepatitis A vaccine is available for children age of 12 to 18 months. It is two doses. And hepatitis A vaccine is also available for adults and can be combined with hepatitis B. Acute hepatitis B does not require any specific treatment. Chronic hepatitis B is treated with antiviral medications. This form of treatment can be costly because it must be continued for several months or years. Treatment of chronic hepatitis B also requires regular medical evaluations and monitoring to determine if the virus is responding to treatment. Here, acute hepatitis does not infection of hepatitis B does not require any specific treatment. But chronic hepatitis B infection can be treated with antiviral medications. This form of treatment can be costly because it must be continued for several months or years. Treatment for chronic hepatitis B also requires regular medical evaluations and monitoring to determine if the virus is responding to treatment. Hepatitis B can be prevented with vaccinations. CDC trusted source recommends hepatitis B vaccinations for all newborns. The series of three vaccines is typically completed over the first 6 months of childhood. The vaccine is also recommended for medical professionals and all healthcare personnel. Antiviral medications are used to treat both acute and chronic forms of hepatitis C. People who develop chronic hepatitis C are typically treated with a combination of antiviral drug therapies. They may also need further testing to determine the best form of treatment. People who develop cirrhosis, that is scarring of liver, or liver diseases as a result of chronic hepatitis C may be candidates for a liver transplant. People who are suffering from hepatitis C who develop liver cirrhosis or scarring of liver as a condition of chronic hepatitis, these candidates require liver transplantation. Currently, there is no vaccination for hepatitis C. No antiviral medication exists for the treatment of hepatitis D at this time. According to 2013 study trusted source, a drug called alpha interferon can be used to treat hepatitis D, but it only shows improvement in about 35 to sorry 25 to 30% of people. Hepatitis D can be prevented by getting the vaccination for hepatitis B, as infection with hepatitis B is necessary for hepatitis D to develop. Earlier only we have seen in the slides, wherever hepatitis B is there, immediately their hepatitis D also there. So one must take precautions not to get infected with hepatitis B. Currently, no specific medical therapies are available to treat hepatitis E because the infection is often acute. It typically resolves on its own. People with this type of infection are often advised to get adequate rest, drink plenty of fluids, get enough nutrients, and avoid alcohol. However, pregnant women who develop this infection require close monitoring and care. Autoimmune hepatitis. Autoimmune hepatitis can be maintained by taking steroids like corticosteroids like prednisone, budesonide are extremely important in the early treatment of autoimmune hepatitis. They are effective in about 80% of people with this condition. Azathioprine, that is Immuron, a drug that suppresses the immune system, is often included in the treatment because autoimmune hepatitis is immune system mistaken as self as foreign bodies and it will attack its own tissues. So, for that, immune suppressant drugs will be used to suppress production of antibodies. In that time, azathioprine, a drug which suppresses the immune system, is often included in treatment of autoimmune hepatitis. It can be used with or without steroids. Other immune suppressing drugs like mycophenolate, next tacrolimus, and cyclosporin can also be used alternatives of this treatment. Instead of azathioprine, doctors may prescribe drugs like mycophenolate, tacrolimus, and cyclosporin. Prevention. Hygiene. Practicing good hygiene is the key way to avoid contracting hepatitis A and E. If when people are traveling, they must carry their water bottle with them and they should not drink contaminated water and they must stop taking ice, raw or undercooked shellfish or oysters, raw fruit and vegetables are not taken in the food. Hepatitis C and D contracted through contaminated blood can be prevented by not sharing drug needles, not sharing razors, not using someone else's toothbrush, not touching spilled food. Hepatitis B and C can also be contracted through some sexual intercourse and intimate sexual contact. Practicing safe sex by using condoms and dental dam can help to decrease the risk of infection. You can find many options available for purchase online. Vaccines. The use of vaccines is an important key to prevent hepatitis viral infection. Vaccinations are available to prevent the development of hepatitis A, hepatitis B. Experts are currently developing vaccines against hepatitis C, hepatitis A, hepatitis B, hepatitis A, and hepatitis C. Vaccination for vaccination for hepatitis E exists in China, but it isn't available in United States. What are all the complications of hepatitis? Complications of hepatitis are chronic hepatitis B, chronic hepatitis C can often lead to more serious health problems because the virus affects the liver. People with chronic hepatitis B or chronic hepatitis C are at risk for chronic liver disease, cirrhosis, liver cancer. Complications of hepatitis. What are all the complications of hepatitis? Chronic hepatitis B or C can often lead to more serious health problems because the virus affects the liver. People with chronic hepatitis B and C are at risk. Those are chronic liver disease and cirrhosis and liver cancer. When our liver stops functioning normally, liver failure can occur. Complications. What are all the complications of liver failure? Liver failure complications include bleeding disorder. Why? Because liver's function is it will produce fibrinogen, thromboplastin, blood clotting factors. Bleeding disorders, a build-up fluid in your abdomen that is known as ascites. Increased blood pressure in portal veins that enter your liver, known as portal hypertension. People who have liver liver failure complications may get portal hypertension. Next, renal failure, that is kidney failure. Then hepatic encephalopathy. In hepatic encephalopathy, which can involve fatigue, memory loss, and diminished mental abilities due to buildup of toxins like ammonia that will affect the brain function. Next, hepatocellular carcinoma. Cells present in the liver are called hepatocytes. So, in liver failure conditions, hepatocellular carcinoma, which is a form of liver cancer. People with chronic hepatitis B and C are encouraged to avoid alcohol consumption because it can accelerate liver disease and liver failure. Certain supplements and medications can also affect liver function. If you have chronic hepatitis B or C, check with your physician before taking any new medications. In India, a bad practice is going on. Without prescription, pharmacists are giving medicines that is a wrong practice. Without prescription, medical shop should not sold any type of medicine. Taking medicines without the advice of physician is very harmful. So this must be stopped. Why? Because excessive drug usage also leads to liver failure. This is one of the non-infectious cause of liver failure. This is all about hepatitis. In this hepatitis, we have discussed about infectious hepatitis. First, we have discussed there are two types of hepatitis, that is chronic hepatitis and acute hepatitis. These are the two. Next, what are the two types of hepatitis? By two, what are the two modes of hepatitis? One is infectious, that is caused by hepatitis virus. And the second is non-infectious mode. In that, we have seen three: alcohol consumption, over drug usage, and autoimmune diseases. Next, in viral, we have seen five types of hepatitis: hepatitis A, hepatitis B, hepatitis C, hepatitis D, hepatitis E. In hepatitis A is not that much danger because taking good rest is enough for hepatitis A. But coming to hepatitis B and C, these two are combined. These are blood-borne mode of transmission. So, because of taking drugs and sharing of razors will be caused this. So, these two are dangerous. Next, next one is when coming to hepatitis D. When hepatitis D is there, infection is there, that person may be suffering from hepatitis B. These two will come in conjunction, that is hepatitis B and hepatitis D. To avoid hepatitis D infection, one must take care hepatitis B infection should not be there. Next, hepatitis E. Hepatitis E comes to only women. mainly in pregnant women. In all these five types of viruses, B and C are particularly blood-borne diseases, whereas A and E are combined D also, contaminated food and contaminated feces, contaminated water. So one should maintain hygiene, personal hygiene. Wherever once he is going out, he should take with him water bottle with him and freshly prepared food is recommended and rehydration and nutrition is also recommended. Then and when a person is suffering on physical examination, his body may show coloring yellow color and skin nails will be yellow color. That is called as jaundice. And right hand right hand side of upper abdomen, any tenderness appears that also get checked by the physician. One is more very for all these hepatitis A and hepatitis B also vaccines are for children and adults vaccines are present. Hepatitis B vaccine is present for both children and adults. It is given in children 1 month to 6 months. This is all about hepatitis. What are all the hepatitis? This is a viral disease. Infectious one is viral disease. So everybody should maintain proper hygiene. Through this, we can stop this deadly disease. That is all about hepatitis. Thank you.